It's time now for Morning Rounds. Joining us are CBS News Chief Medical Correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips. First up, there was encouraging news this week about the fight against cancer. John?
Benita, one promising new approach doesn't use drugs or radiation. It uses the patient's own body to attack cancer cells.
At 35, Erica Wallace learned she had advanced cervical cancer that had spread to her lymph nodes.
It just kind of became, all right, just deal with it. Tell me what I need to do because I'm a mom and I need to be here for my boys.
Intensive chemotherapy did not work. The Wallaces were told Erica had about a year to live.
I had to discuss, what if I'm not here? You know, what's going to happen with the boys, because I could feel I was getting weaker, and so I was pretty rock bottom at that moment.
Just 2 months later, she became patient number 2 in a small trial using the body's immune system to seek out and destroy metastatic cervical cancer. Dr. Christian Hinrichs at the NIH Clinical Center leads the trial.
The treatment that we do, we completely rearrange the immune system.
Doctors take a piece of the tumor and extract specialized white blood cells, or T cells. Those are tumor-fighting cells sent by the body's immune system to target the cancer. The T cells most potent against cervical cancer are selected and grown in the lab. Billions of these cells are then infused into the patient's bloodstream.
The idea is to give a single treatment and have the cells wipe out the tumor the same way that they would clear an infection.
6 of 9 patients in the study had no response, and 1 had a partial response. 2 had complete remission. Wallace was one of those 2. This is a scan from her checkup last week. Nearly 2 years after treatment, there is no sign of cancer. Earlier this year, her younger son Marcus had a chance to meet the research team.
He looked at them and said, "Thanks for saving my mom." And that's what NIH has done, is saved me.
What a great story.
Yeah.
I mean, this seems groundbreaking.
Yeah, and it's exciting for the future because cervical cancer is a so-called solid tumor, and we've traditionally not had a lot of luck treating widespread solid tumors. And the hope is to use this same technique for other solid tumors like tumors of the lung, breast, and colon.
Such encouraging news. Also this week, there was promising news for men with advanced prostate cancer. A new study shows an older chemotherapy drug can significantly lengthen lives. Holly, tell us about this study.
You know, Anthony, this was a very long-term study. It looked at it went over 10 years. And, you know, it really sort of turned our understanding of how to treat prostate cancer on its head. Up to now, in fact, for the last 75 years, the standard of treatment with metastatic prostate cancer has been to use a hormonal therapy. And then we only add chemotherapy if that doesn't work. This study showed with metastatic prostate cancer, if you add the chemotherapy earlier along with the hormonal therapy, you can increase men's lives by almost 14 months. That's an incredibly long time, so it's very impactful.
I think it's surprising because most people hear the word cancer and they immediately think chemo. So why was it not being used in the past for prostate cancer?
Well, Vanita, basically because we didn't have this data. You know, it took a long time to get the data, in part because men aren't enrolled in as many clinical trials as women are. So our understanding of prostate cancer lags behind our understanding of, say, breast cancer or some other conditions. But also, the chemotherapy has side effects, so no one wanted to use it unless we knew for sure that it works, and now we know that.
Well, there's also some good news about preventing cancer this week. Researchers at Yale Cancer Center estimate that from 1976 to 2009, screening tests like colonoscopies prevented more than 500,000 cases of colorectal cancer in the U.S. A separate report says that worldwide, the number of survivors of all kinds of cancer will increase by 30% over the next decade.
A new report in the journal Pediatrics raises troubling issues about kids and ads for e-cigarettes. The new study says that from 2011 to 2013, ads for the smokeless devices aimed at kids from 12 to 17 years old jumped more than 250%. During that same period, e-cigarette ads targeting young adults from 18 to 24 spiked more than 320%. The brand advertised most often is called Blue. Take a look.
You know, I love being single, but here's what I don't love: a kiss that tastes like an ashtray. Blech. I'm Jenny McCarthy, and I finally found a smarter alternative to cigarettes. Blue e-cigs. Blue satisfies me. I get to have a blue without the guilt because there's only vapor, not tobacco smoke.
John, where are kids seeing these ads?
they are seeing them everywhere. They're all over the internet, they're on television, and they're on stations you'd expect with kids 12 to 17. So comedy, music, adventure shows, it's just everywhere you look.
But what can a parent really do in this battle then when they seem to be targeting these young kids? Right.
Yeah, I mean, it's a major concern for parents, really, because the big question is, are e-cigarettes a gateway drug into using regular cigarettes? And in all fairness, we really don't have data to show whether they are or are not yet. But what we do know is nicotine is, of course, one of the most addictive substances that's out there. And the earlier you get hooked, the harder it is to quit. So it would stand to reason the more we can protect the kids from getting started, the better.
So, John, what should you do if you're a parent and you know your kids are exposed to these ads?
Well, we're in a strange period right now where there's no widespread advertising talking about the possible risks. I spoke to the FDA this morning. They said they have proposed at the end of April to regulate this. It's not regulated right now. So I think for now the parent has the role to explain the possible risks, which include that in the developing brain that could be more susceptible to getting addicted. And plus we now know from some studies there are dangerous toxic chemicals that are released in the vapors.
Maybe the ads could be a good place to start that conversation. Finally, most people know that two of the best ways to prevent cancer and many other diseases are exercise and eating right. But that could be easier to do depending on where you live. This week, the American College of Sports Medicine released its annual list of the healthiest cities in the United States. So, John, who should we all be jealous of?
Drum roll, Washington, D.C., the nation's capital.
Really?
Yeah,
that's interesting.
I love this, actually. I love this idea. We had talked last week about the importance of changing the environment and making it so you just trip over healthy behavior. So get a little competition going. Have some other city try to vie for the best.
And some of the other top cities are bigger, more open spaces. We think of D.C. as a very cosmopolitan, cramped space, but it shows you can be healthy in pretty much any environment.
That's right. New York was 25. I wanted to make sure we were. Dr. John LaPook, Dr. Holly Phillips, thank you.